Right, well, good afternoon, everybody. Welcome. Thank you for giving us some of your time today. For those that are new to this group, Russell has set this group up to provide public health communicators like yourselves with regular and timely free learning events to share insight, learning and case studies. As public sector communicators, we rarely have sufficient resources for the gargantuan tasks we are tasked with. So sharing and collaboration are more important than in any other sector. Our ambition is to give you something that you can use every time you attend one of our events. We also want to encourage sharing within the group, so please do share any examples, insights, or even any questions that spring to mind as the session goes in the chat. Today, we're focusing on health improvement, specifically smoking cessation and promoting responsible consumption of alcohol. Timely in terms of the festive season, but also these things are always on challenges for public health professionals. So Russell has been researching examples of excellence from across the UK and has assembled a group of experts in the field. Russell's been working in public health communication for many years, and today we want to share with you some excellent case studies and to give room to share their expertise with us. So Russell, are you ready to take over?
Indeed, thanks, JP, and thank you to everyone for joining. I'm really excited about setting up this hub, and for public health and NHS comms people. We want these webinars to be useful for people. So if you've got any ideas for topics that we should cover in future sessions, please do post them in chat, and we'll have a look at them and see whether we can help with things like that. But today, as JP said, we're discussing two really important topics, which play a huge part in the health and well-being of our residents. So smoking and alcohol, and together they account for in England well over 750,000 hospital admissions a year. Smoking causes around 75,000 deaths per year. We all know about the kind of the other knock-on effects on health and well-being. So I'm delighted today to be joined by Wendy Elcome, who is head of public health programs at the Royal Borough of Greenwich. Wendy's a specialist in both areas and has more than 20 years experience working in these topics. So he's a real wealth of knowledge. And Wendy we're going to start the session by asking Wendy to answer a few questions. Wendy, I think I've introduced you, but if there is anything else you wanted to quickly say.
No, thank you for having me. And I get a bit nervous about the serious expert, but I think I am after 28 years. But yeah, hopefully.
Yeah,
hopefully I've got some wonderful insight for you all.
Yeah. Okay, so Wendy, what are some of the main challenges in getting people to change their long-term behaviour when it comes to tobacco and alcohol use?
I think the most important thing to remember is that for both of these, we are certainly with smoking, we are dealing with addiction here, and we've got to start off with that, and certainly with alcohol and alcohol dependency. We are dealing with a serious addiction, and I think a lot of the time and over the years that I worked, when I started off, really, you're thinking, put a poster up, tell people that they shouldn't be smoking, and then you've done the job. And actually, it's so much more complex than that. And as you know, we've been very successful in England and the UK to reduce smoking prevalence, and we are now in the region, certainly in London, around the 13% prevalence mark. But what we've got now in that challenge is that we've got really entrenched behaviours. We've got people with very complex lives, lots of other issues going on, comorbidities, often now with people that have got mental health issues, with high levels of deprivation, and issues around health inequalities are massive. And with alcohol as well, we've got the challenge of access and availability, affordability, acceptance, that it's, not seen as, a problem. It's very much all around us and heavily promoted. And then with the pandemic and stress and cost of living, it's a perfect storm in terms of people being able to sort of access support and finding their way around. So I think for us, we've got to find out what motivates people to want to change, look for those triggers, make sure that it's really obvious where people can go and get help, but also encourage and support people to say that that is the best thing to do. We know most people will just think, oh, I don't want to join a group, or I don't want to go and get help, but it's actually the most effective way in which we can help support people with changing their behaviour. So it's about signposting for support, but before that, we've got to trigger those quit attempts and trigger awareness of people's own behaviour. So that's really important, and look at what motivates people to quit, and then give them supportive messages that are associated with their reasons for wanting to change. So I think that's really powerful. I'll shut up. Sorry.
Thank you. No, that's good. I mean, I think, you're right. Those motivations are really key, aren't they? And triggering those. I think so. With that in mind, do you think a kind of one size fits all message works for tobacco and alcohol management?
No, definitely not. And I've learnt that through experience. Just going back to sort of me just standing outside a shop with one poster, or putting a few posters up in a workplace and wondering why people are not knocking down our door in hordes to come and get help. That's the biggest evidence, really. We're all human, we're all different, we've all got different needs, we've all got different backgrounds, we've all got reasons why we do certain behaviours, and you need to tap into that. And I think, targeting certain communities, certain populations, like I said, around smoking in particular, we know where our smokers are. We know large numbers of smokers are in hospital. We know large numbers of smokers are visiting primary care. We know smokers are in our deprived communities and within certain populations. So we know a lot of information. So we need to be looking at our communications very much in that targeted way, and reaching out and talking to those audiences. And the same with alcohol. I'll go on a bit later to talk about a particular campaign that we did, but very much segmenting people into, maybe the types of drinkers they are, but also raising their own awareness of how they're drinking and why they're drinking, and doing mindful drinking really as well. So people are aware of their triggers and motivations, but certainly we need to be very targeted in our communications.
Yeah, thank you. And then you've sort of touched on this, but is it true that both smoking and alcohol rates are higher amongst populations where deprivation is highest?
Yeah, I mean, as we all know, within public health, there is a very strong correlation between deprivation and poor health outcomes, and that's why everything we do in public health really is around tackling those health inequalities and acknowledging the wider determinants, because we have to take into account, access, and legislation is really important with that. And we do know smokers are very much in those more deprived, lower socioeconomic groups. With alcohol, interestingly, when we did our campaign across Greenwich, which I'll talk about again later, we found a bit of a paradox situation going on, really, where we saw, high levels of drinking across the whole of the borough, but there was dangerously high and increased risk within the lower socioeconomic groups, but there was in the higher category, but across all of the wards and populations, there was an increased risk going on. So it's the cumulative effect of that in terms of social care and in terms of healthcare for the future, for those people that are drinking at an increased unsafe level. And then the high dependent smokers were very much more in the deprived group. So it varied for alcohol, and we were quite surprised to find high levels of drinking, increased levels of drinking amongst our more wealthier wards. And then again, looking at access for that, and particularly home drinking, is an issue. We talked before about, you know, licensing laws, and, you know, you can go to Tesco 6 in the morning till 12 at night. So, you know, you're accessing the affordability of alcohol. You know, it is much cheaper to go to the supermarket than it is to go to the pub. You know, the difference is huge. So we're quite concerned about making sure we're looking at how we can influence licensing as well and access. So thanks.
Brilliant, thank you. And then I guess building on that, you know, inequalities is an issue. Is there a risk with campaigns and different interventions that actually we could widen health inequalities?
Yeah, I think so. Like I said before, I think that, you know, the most common method, you know, particularly for smokers, is I'm a happy smoker one day, then something might trigger them, like they've run for the bus and they're out of breath, or a grandchild might say, "Oh, Nanny, you smell," and that would be the trigger for them, and they might then just wake up one day and then say, "Right, I'm going to quit today." And the most common method is just going cold turkey, but as we know, it's the least effective method for becoming a successful non-smoker. So we want to drive people into the support that's the most successful support and the evidence-based. The same with alcohol. We are so under treating in treatment services. The numbers could be so much higher, but we've got to get people's confidence in terms of, you know, accessing support, and for them to know that it is the most effective way for them to get support and to quit smoking or to get support with drinking. So it's driving people into that support. I think things around campaigns can be talking to sort of, in inverted commas, the walking well, you know, things like Dry January. It's a great campaign to raise awareness, but we've often seen that people that are not drinking increased levels of alcohol anyway, engage in those sort of campaigns, you know, "Oh yes, I'm going to stop for a month." But what we want people to do is like drink sensibly all year round and drink under the 14 units all year round. And quite often the people that engage in those campaigns are not drinking over 14 units anyway. So they're great for sort of maybe universal raising awareness, but we actually want to be promoting much more about, you know, having drink-free days and where you can get support and being mindful drinking. Things like Stoptober have been great, because with smoking in particular, we know if someone does stop for 4 weeks, they're much more likely to stay stopped. So the evidence is there around, you know, Stoptober being a really useful tool to engage with. And in the new year and things, we know that OHID are going to be relaunching sort of health harms and better health campaigns around tobacco as well. So that will be good to look out for in terms of being able to amplify some of those locally. So I think those days and awareness have their place, but it doesn't substitute targeting and local work and really directing your comms to specific communities, really, and where the smokers are at, or where you know your drinkers are at, things like that.
Brilliant. Thanks, Wendy. So the way that people use alcohol and tobacco varies, and different people, you know, will have different motivations for giving up smoking or cutting down their drinking that we can tap into. However, behaviours around both can be incredibly hard to change, especially in the long term. You know, so what we're often trying to do is change like entrenched behaviours and habits. And you know, an example of this that people might remember is there was a drink-free days campaign, which was going back a few years. It was a collaboration with Public Health England and Drinkaware from 2018, and you know, it was a campaign that aimed to encourage people to have more drink-free days, and it had good results in terms of recognition. So their evaluation showed that 35% of their target audience recognized the campaign and recalled it. However, they were unable to show any real kind of impact in the campaign. No evidence that it changed anyone's behavior and increased their number of drink-free days. So to tackle these issues, I think it is really important that we use a behavioural science approach to plan the campaign and also our other activities. You know, it is to try and, you know, Wendy talked about the motivations, but I think also to try and understand the barriers and what might motivate people to change their behaviour, and how, you know, what might drive them, So some kind of key principles I think too that are helpful to follow when you're doing that. Wendy talked about this, but I think it's really important to segment your audience and target them. Not everyone has the same motivations, not everyone has the same reasons, everyone's influenced by different things. So it's really important you segment and you target. Lots of people as well recognize that changing their behavior is their responsibility, and will often try to do, particularly with smoking, they'll try to do it without help. Wendy talked about people going cold turkey not being the most effective, but typically those really entrenched long-term smokers often they've got it in their head that they're going to give up. Eventually they try and they do it with no assistance, and often that fails. So I think it's about trying to point them to that help, isn't it? And people need to be ready. So some sort of short, sharp campaign is going to have limited effect, I would say. These topics really are examples of where you need an always on approach. It needs to be always on. Mate, you can have some bursts of additional activity, but it needs to be there for when that smoker decides it's time for me to quit. It's important that you carry out research to enable you to develop behavioural insights, which look at which look at what has been done locally and nationally. What insight is already available, and then carry out a bit of your own research. To enable you to understand what stops people in what the barriers are and what stops people giving up smoking or drinking less in your area. So you could do some focus groups, you could do some surveys, any number of things to develop your real kind of local insight. And this will enable you to develop your understanding of what might motivate people to change in your area. And you can then use that to plan your campaign and plan your communications. I haven't got time to go into it now, but the ComB tool is a very good way of doing that. If some of you may have used, and we will post a link to some tools for that actually after the session in the materials. Another thing I would say is, if you're going to go to all this effort, sadly you do need to invest in it. Invest in some adverts. If you're talking digital stuff, sadly, organic posts are going to have virtually no impact nowadays. But even a small budget can really make a difference. So you do need to invest in it if you're doing it. Test your messaging and creatives, so that you can land on ones that really do resonate with your local audience. And I think this is really key as well from some of the research that I've done. Don't bombard people with too many choices. If you've got 10 different interventions available to help someone stop smoking, you don't need to present them all to them at once at the very, when you first make contact with them. That will just confuse them. It will put them off. It's really important that you present people with a very simple kind of choice architecture. You can tell them all the different options a bit later, but when you first get them or get their attention, keep it simple. And then just one other final thing, I think as well with these particular behaviours, I think it's important that you can't rely on just comms and campaigns. You need to look at combining your communications, combining your campaigns with other interventions, and a little bit later, Wendy's going to talk about some outreach in Greenwich around alcohol, which we'll come to. So yeah, I'd now like to ask David to talk. So David's from David, do you want to introduce yourself actually? Well, then I put words in your mouth.
Yeah, thanks, Russell. So yeah, I'm from 22 Design. And we've worked on, we're a creative agency. We've worked with lots of health organisations over the years, creating hopefully successful campaigns that have helped change people's behaviours. And I think what we've learnt, we deal with NHS organisations and public health organisations, but also we work with lots of pharmaceutical companies and sort of big business, and taking lots of the learnings that we get from those campaigns, where they spend, you know, millions on changing people's behaviours or changing them from one broadband provider to another, or one thing for another, to actually taking those learnings and using those where budgets aren't always as big, but actually making sure that we can be as effective. And lots of the things that Wendy and Russell have touched on sort of play to those things. So we've got a campaign that we a smoking cessation campaign that we ran. I'm just going to share my screen a second. So this was a campaign that we ran for 31 London boroughs. So again, getting together with other people who obviously these are issues that go across boroughs and boundaries. So working together and hopefully getting more budget, more insight is always a good idea. This campaign, when we sort of briefed it, was attacking sort of young smokers and trying to get them to quit, or trying to get them actually to call the helpline. To Wendy's point earlier, actually, it wasn't trying to get them to quit necessarily, it was trying to get them to engage with a service that would help them quit, which we found to be far more successful. Again, to the points that were made earlier, in this instance, we looked at the target audience, and research showed that positive messaging was more effective with them than going sort of scaremongering with health health
risks.
Disease, and all of those reasons which they already knew. So coming across with positive messaging, reaching them online where they were. So again, you know, if you know your audience isn't going to be going to the pharmacies and see the poster, then meet them where they are, using messaging that resonated with them, testing that messaging and ensuring that it is doing what you think it's going to do, and also representing them in the ads. So if you need to localize something, so if you are targeting a specific audience, specific demographic, then represent them in what you're doing rather than choosing something that you think looks good. And because of all those reasons, this campaign was really successful. I will hand back over.
Thank you, David. I've seen in the chat some brilliant suggestions. Louise was talking about a future session around the use of language or behaviour change inspired language, which I think is a brilliant idea. Little changes to what you say can make a huge difference. There was also Tanisha suggesting or asking, has any work been done around communicating to the people around the person, either trying to quit or stay off cigarettes or smoking or alcohol, and basically educating the support group around them. Does anything spring to mind, Russell or Wendy? Have you come across anything like that?
And I've certainly seen, I couldn't think of a specific example, but I can certainly recall smoking campaigns where, you know, I mean, there's the like, you know, there was a famous one with children smoking, wasn't there? And you know, and that was more, but Wendy, have you?
Yeah, I mean, it's certainly emotion, obviously, as we know in any advertising is powerful tool. So being emotive about, you know, what you're going to be missing out on. And there's been certain things, you know, I want to spend time with my grandchildren, and, you know, family members sitting watching those kinds of ads and seeing people that, you know, might not be around for the future. It's triggering those conversations, I guess. But certainly things around like smoke-free pregnancies, we've done a lot to be, you know, it is very difficult for a pregnant woman who's smoking for having her partner smoking around them. So we promote within our service that, you know, the service isn't just for the pregnant woman. It might be for her mum, that might be her birthing partner, it might be her partner, and that we would want to encourage the whole family to come in and be part of that smoke-free pregnancy. And so it's very important to have those support around people. But I do think that, you know, there has been campaigns in the past which are very emotive, trying to encourage and play. the other thing I would say around targeting is it's just not around, you might want to, you know, you want to be also targeting relevant stakeholders to be aware of your campaign as well. So we're talking very much talking to the smoker or talking to the drinker, but in fact so many other people need to be aware of the campaign so they can have those conversations. So, you know, if you're going to do something and have a peak period of time locally where you're doing a stop smoking campaign, for example, make sure you're telling your health professionals that it's running, make sure the GPs are aware, make sure, you know, your social care teams are aware and your frontline staff, so that, you know, a smoker may then be much more likely to be in, you know, in a place where they might respond to some motivational interviewing. And so if the GP is aware that there's a campaign running locally, they can then say, well, have you seen the campaign, or have you seen the screening that's going on at the moment? So it, you know, you're trying to encourage those conversations in multiple places. So it's really good that you're making sure that your partners and your stakeholders are aware of the campaign, not just the target audience, so they can have those conversations as well.
Yeah, no, that's really interesting. I haven't come across that, but it makes so much sense that your support network, friends, family, people you live with, are aware of what you're doing. And maybe you equip the individual to educate them or equip them to support the individual. It must be a factor that dramatically increases the success of the interventions. No, that was a really interesting question. Thank you for that. Russell, back to you.
Yeah, thank you. Wendy, I'll ask you if possible to just talk a little bit about the What Kind of a Drinker Are You campaign.
Yeah, thanks, Russell. This is just an example. It was in 2019, January to March, so pre-pandemic, if we can remember what life was like then. So we ran a 8-week campaign, and it was very much based around, like we said, segmenting people into sort of what kind of drinker are you, and it was kind of fun and light-hearted because we wanted to get people having those conversations. So we segmented people into like the weekender drinker, the regular, the winer diner, the stress buster, and then ultimately the gold prize was the mindful drinker, someone that was, you know, aware of their drinking and watching what they was drinking and having alcohol-free days and things like that. So we actually took it out onto the streets into a roadshow kind of outreach program for those 8 weeks. We went to 5 different locations across the London Borough of Greenwich. We went to high footfall areas, so supermarket car parks in the main and shopping areas where we knew we'd see lots and lots of people, and also trying to target our more deprived areas where we knew we would have you know, we need to get to in terms of inequalities. So over that 8-week period we actually sort of engaged with over 12,000 people. We had quite a lot of brief interventions, so it was nearly 600 actual discussions with people, and we had 500 of the audits taking place. And when I say audit, we were encouraging people to take the IBA tool, which is sometimes known as the Audit C tool as well, so where people can actually go through and look at their drinking and think about how much they're drinking. And what we found over that 8 weeks was over 1/3 of people that we that did the tool were drinking at an increased risk, and 1 in 10 were drinking at a high risk. So it was a really interesting campaign. People still talk about it. We produced a lot of really, you know, lovely assets and graphics. We also talked about, you know, what was a unit of alcohol. So we did, you know, different examples in the little card. We had postcards with QR codes straight to the IBA tool so people could take the online tool. So it was really good, and we want to repeat it again now that pandemic is out the way. We want to be able to go out and have that again, so we're hopefully going to be trying to plan for that next year to repeat the campaign and refresh it, budget permitting. But yeah, we you know, we want to go for that again. But it was really well accepted and talked about, and you could visually see the increase in the IBA tools during that campaign period. So it was completely correlated. When we were out and about, you could see it going up in terms of numbers and then dipping down again after the campaign. So you could see a direct effect of the campaign and the promotion.
Brilliant.
Thanks.
What strikes me a lot, that I wasn't thinking before hearing you speak, Wendy, is the number of different approaches and audiences you really need to consider. You've got the relatively easy wins, relatively low rates of smoking and drinking, maybe slightly more affluent. That's a very different sort of positive incentivized type activity to maybe some more entrenched smokers as well. Whereas it's not just about getting everyone into a specific pathway. There may be many different approaches to motivating people towards an effective intervention.
Yeah. And certainly with smoking, we know the evidence shows that we want to trigger multiple quit attempts. Most smokers have tried to quit, 10s, sometimes 20 times, 30 times, and quit for a little while and then gone back to it. But the more likely they try and the more we can signpost them into support, the more successful they will be. But we've got to trigger those multiple at scale quit attempts, and that's where comms can be really helpful. But we do want people to get to the support that's right for them. So again, it's about, the digital support, the apps that might be available for people that just need a little bit of hand holding and a little bit of support. But we need to make sure people know they will get their pharmacotherapy, so like the nicotine replacement therapy or swap to stop type. If we want to do a lot of work around vaping and moving people to switch. So we need to do a lot of campaigning around, vaping, because that's quite confusing at the moment in terms of messaging and safety. So yeah, I think we've got to be looking at the different levels of intervention suited to that particular type of smoker and encourage them to get what help they want, but it's suited for them.
Yeah, really. And that really does feed into Russell's earlier point about you kind of need always on streams for all of those different audiences over long periods of time, rather than a hashtag for 2 weeks type thing. It is highly likely not to be as effective.
Yeah, that's where I think, though, you need to be always on in terms of the people that need to promote your services as well. Because, however hard I try, 20 years on from Stop Smoking Services being in the UK from, the year 2000, we're 23 years on and you'll still get, GPs or a health professional saying, I've never heard of a stop smoking service. And we're 23 years with having stop smoking services in the country. So you're never going to get everybody, but you do need to keep pushing and making sure people are aware that they know where to send people when they ask for support.
Brilliant. Thank you, Wendy.
Yeah, thank you. So I'd like to now show you an excellent example of a smoking campaign that I came across whilst researching this webinar, and this is the work of Sam Neville, who works in Greater Manchester, and it's the latest iteration of their Make Smoking History work. And it's, I had a long conversation with Sam. Like I said, unfortunately, she wasn't able to join us today. But they really have they've gone down very much down the behavioural science approach. They've done lots of research into the different audiences they have in Greater Manchester, and actually they found that there are sort of two approaches. There's the very hard hitting, which isn't necessarily popular and can be quite emotional, but that seems to work better with those very long-term entrenched smokers. That's what has the impact. Whereas things that focus perhaps on the personal benefits or the more positive messages, like the money, etc., work with the less entrenched smokers, I guess. So. And this video is, I'm going to show, it's only a short video, but yeah, I think it's really good. I would say Sam was very happy for me to share this, but she did say, please do share it with a bit of a warning. Some people do react quite emotionally to it when they see it. So yeah, just to give that that caveat. So I'm going to show you this now.
This next one is from Dad. I'm sorry I can't be with you on your special day. You have a wonderful future ahead of you.
I just wish I could be part of it.
Download the smoke-free app and get the help you need to quit.
Yeah, so I mean, it's very hard hitting, and like I say, it focuses on the loss really of continuing to smoke. Now, they don't, so they use that particularly. They've been running TV adverts and things like that with that. They're also doing out of home, and they tend to do that's much less hard hitting. So you know, there's kind of the general messaging which kind of complements that and uses, you know, but it is less hard hitting. But I think, well, I think the campaign's excellent from what I've seen. I think Greater Manchester are lucky; they've really invested in smoking. So Sam is a communications manager, and her full-time role is smoking. So you know, serving a population of 2.9 million, they're very lucky to have, you know, made that investment, and I think they're starting to really see the results. So in the last few years, their smoking prevalence has reduced from 18% to just under 15%, and they've carried out an independent evaluation which has looked at the reasons behind that reduction in smoking prevalence, and that evaluation has proved that the campaign has been a big influence in that. So it's you know, it's a really good example of a campaign that's showing real impact and, you know, really doing what it intended to do. So yeah, I'm really pleased to show you that, and I think there's some definite learning for us all in that. So I think I'm going to hand over to JP actually.
Thank you, Russell. Yeah, that is sort of both ends of the spectrum there. You've got the positive motivation, the sort of carrot and stick elements. That was very impactful indeed. It'd be wonderful to see if they're willing to maybe share that creative and let other locations use it, if they're up for it in certain places. And the same with David's creative. I believe that's possible to be licensed and switched on in other locations. Those sorts of tactics are about reducing the amount of budget that you need to spend kind of starting from scratch. And the point of this group, I think, is to share tactics, experiences, but also assets with each other, so we can achieve a lot more with probably less and less as we move forward. One thing we want to give you as well in this group for free is insight into what people are actually typing in around these sorts of subjects. When people are really serious about something or just researching, search is where they go, and as a result, it's a window into the consciousness of populations in different parts of the country. So we've done a bit of research for you. Let's look at the smoking first. This is useful because it gives you an idea of the seasonality potentially and the kinds of words and phrases that people are typing into search engines. This is at the England level. Any of you attending this who want to want this done for your location, more than happy to run it again for you and send you that data for free. But it helps you understand what people are thinking of, also what they're not thinking of. And maybe that will help with understanding the kind of language you might want to use in a campaign, and also potentially how you can shape and place advertising around search terms. People, for example, searching for nicotine patches, that would be a wonderful place to have a search ad for the Stop Smoking service in a location. But if anyone would like this done for smoking, or when we look here at alcohol, we can see that searching for the terms alcoholic, large volumes, but also a fairly consistent volume of people looking at liver damage or reducing alcohol or drinking too much. Again, these are very good points, which, thanks to search advertising, we can then intervene when someone exhibits these kinds of these kinds of terms. So yes, again, if you want it, just drop me an email and tell me the location you want to do it for, and we'll send you this data. And I think sometimes turning up when you're planning long-term campaigns, being able to turn up saying, here's some excellent examples from Manchester or London or other locations. Here's some data about what's going on in our location, and therefore here's what I think the design of our campaign should be like. Hopefully gives you a much stronger insight basis if we're thinking about the OASIS methodology for designing campaigns. This is a really strong start, and I think with this group, that's what we want to do. We want to give you lots of information that kind of gives you more clout in those discussions and helps you build the business case for investing more in communications that deliver measurable outcomes. But yes, drop me a line if that's of interest. More than happy to share that with you.
Thanks, JP. That was really really interesting. Wendy, did you want to come in?
Yeah, it was just an opportunity, really. Most people on the call will probably be aware that the government have just announced extra investment into supporting and encouraging more people to stop smoking, and all local authority stop smoking services are getting extra investment from April. We're expecting in January and February time to have the guidelines and the conditions of that grant allocation, but apparently it's going to be quite flexible in terms of what we can use that money for, in terms of extra capacity and training, but also around promoting stop smoking services and making sure we're triggering those quit attempts. So it was just to sort of raise that, where people have been struggling with budgets, we're really going to be in a more fortunate position where we're getting extra investment in stop smoking and services. So again, being creative, thinking about working together on a bigger footprint, sharing assets, sharing campaigns, and like JP sharing some of that, where would you, more money, more effectiveness for the money, and where would you put advertising and promotion and targeting. So it was just to sort of raise that that is an opportunity to start planning with your public health stop smoking services or wherever they're based to think about that comms opportunity coming.
Brilliant. Thanks. Don't miss out. Don't miss it when this funding comes. Grab it.
Yeah, but it's a really good point about potentially pooling resources and working on a bigger footprint or sharing some of the creatives or things that have worked well in other areas. That's definitely got to be a way of making the money that we do get go further and have more impact. So yeah, just see in chat there's a question from David actually about the Manchester campaign. So I think I'm not 100%, but I think they used both online and TV. On TV, they've been targeting. The problem with TV is I think they have to target a broader area. So it's not just Greater Manchester, but that's the decision they've taken. I think the end of the ad might be slightly differently to reflect that, because the app that they use is only licensed for people within their postcodes. But yeah.
Brilliant. And I believe as well, yes, so Lucy was saying, she'd love to look at various successful approach and campaign approaches. Russell, would you be happy to share the various examples, and David as well, obviously, and Wendy, with the group, anyone that's come to this, we could do an email and just collate all the different resources for inspiration, and also happy to add search to that as well.
Yeah, I think
Leanne's just asked a question. Oh, go on, sorry.
No, I think what we'll do is we'll put all of that in on the web page with some of the recordings and stuff. We'll put all of that, links to everything on there, and then email everyone who came and people who couldn't make it, so they can see those.
Wonderful, thank you, Russell. And we've got Leanne, our good old friend from up in Scotland, asking about vaping. I've heard more briefs coming in around this subject, particularly getting younger people to stop. Have you got any experience or insight? It's a relatively new area.
It is, and I do think there's a real risk with vaping that we're giving off mixed messaging, because we're, on the one hand, we're advising smokers, especially long-term smokers, to switch to a vape, but then we know that more and more young people are vaping, and who've never smoked as well. But yeah, I don't know whether Wendy, you wanted to come in and add anything on that.
I would say it's probably a 3-hour discussion by itself. So I think it's probably worth putting it on your forward plan to have more of a discussion on that, because it is a tricky topic to coordinate in terms of, you know, that messaging, like you say. But I know OHID, with their New Year campaign around better health, I think they are going to be tackling some of that, dispelling some of the myths around vaping and trying to encourage it very much being a cessation tool for adult smokers, and making that messaging really clear. What we're talking about is that it's over 18s, it's for smokers to switch, it's not a fashion accessory, and we don't want young people to you know, be you know, using vapes. So there's going to be a lot of work next year coming out around that. We've done work in schools with head teachers and focus groups and surveys and things with young people. So yeah, I think it's another topic. I think it's an interesting one, but I think it's another topic for you to have a think about.
Definitely, it would be great to have Leanne's input on that. She's an expert in co-creating content with young people. So I think getting young people to spread the messages rather than the top down, I think could be really powerful in that context as well. Lucy, yes, no problem at all. We'll certainly share that search data with you. Yeah, there's also some around positive health intentions around, exercising more, changing the way you consume other things, food and things like that, which I'm sure many of the techniques around this can also be applied to those. Yeah, no, Lucy, we will follow up with you there. Thank you. Russell, did you have anything else to share with us?
No, I don't think so. I'm just looking at chat.
Great.
I think we've covered most things in there. So
It's been really, thank you so much for putting that all together. I've been particularly struck by actually how multifaceted the approaches need to be, and to really consider the different audiences, very different messages. I think as well, considering the people around, people who are trying to reduce or stop excessive alcohol intake or smoking. Those are things I can definitely take away. In terms of, I'm just putting a quick poll in the session. If everyone's happy, just to let us know. We want to make sure we're doing the right job. You know, if there's nothing new here today, we need to improve that. But also, if there's something that you can take away, that's our ambition. That's what we really want to do. Also, please, if there's anything that you've got coming up that you'd like us to focus on, any subject areas, please put it in the chat or email us, email Russell. It would be great to find out if the team at Manchester would be interested in sharing what they've learned with the group. And I think just helping each other with insight, with examples, so that we don't have to keep reinventing the wheel in different locations. Very grateful to Wendy again for sharing her experience with us. It's always enlightening, and you're sort of leading the way in that part of London, I think, with pushing that, and the amount of time you've spent doing this has just been invaluable. So thank you for that, and thank you also, Russell, for all the research and the reaching out that you've done. It's really exciting. I look forward to these sessions a lot, and they always sort of re-inspire me for going over those grounds as well. And David as well, for sharing your the Stop Smoke or Great Things Happen campaign, which I believe the NHS have sort of adopted more wide as well. The ultimate form of compliment, plagiarism like that. So yeah, thank you again for everyone who's attended and for sharing your time and your feedback. It's very much appreciated. I hope that there is some aspect of a wind down towards a very peaceful Christmas and an exciting, fulfilling new year for everybody. We look forward to seeing you in January. Thank you so much.
Thank you, everyone.
Thanks, everyone.